Let me paint you a picture. It is 6:45 in the morning. Your alarm goes off. You open your eyes. And for the first time in 30 years, the first thought in your head is not, "Who called in sick today?" It is not, "Did I chart that correctly before I left?" It is not, "Did I leave enough staff on the floor?" It is just morning. Bird song. Maybe the smell of coffee. Possibly a cat sitting on your chest, which is medically inadvisable but emotionally very healing. No pager. No overhead announcement. Nobody screaming your name from 4 rooms down. No patient who has just discovered that the call light is, technically, a toy. Just quiet. Actual, physical, earned quiet. If that sentence made you exhale, and I mean really exhale, the way you have not exhaled since 2003, then this video is for you. Welcome. This is the Retirement Abroad video that was written specifically for nurses, healthcare workers, the paramedics, the healthcare assistants, the scrub techs, the ward clerks, and every single person who has spent their career keeping other human beings alive, often at the direct expense of their own well-being. You spent your career being the most competent person in almost every room you walked into. Today we are going to talk about what that competence can buy you, when you finally stop spending it on everyone else and spend it on yourself. I want to start with some numbers because nurses are people who respect data, and the data here is both sobering and, in a strange way, vindicating. A 2025 survey of more than 12,000 registered nurses found that 58% report feeling burned out most days, and 64% suffer from compassion fatigue. 33% are currently eligible for retirement. AMN Healthcare read that last number again. 1 in 3 eligible nurses has not yet retired. Some of them are watching this video. In a separate 2025 survey of 1,000 registered nurses, 74% reported feeling emotionally drained from work multiple times every week. 49% have felt unsafe due to verbal or physical aggression from a patient or a patient's family member in the past year alone. Joyce University. You did not sign up to feel unsafe at work. You signed up because you wanted to help people. Most of you still do. That calling does not go away. You will notice symptoms on strangers in restaurants for the rest of your life. You will assess pain scales in your sleep. You will instinctively reach for gloves in situations that have absolutely nothing to do with clinical care. The job goes deep, which is exactly why the transition out of it needs to go equally deep. And for a growing number of nurses and healthcare workers, retirement does not mean a small house near the grandchildren and a garden that gets progressively out of control. It means something bigger. It means going somewhere. Somewhere warm, somewhere quiet, somewhere affordable enough that the pension actually stretches instead of being immediately devoured by rent, utilities, and a healthcare system that, and this part is almost darkly funny, you spent your entire career propping up. Let me make the case quickly because this is the part where some of you are thinking, but I couldn't. More than 138,000 nurses left the workforce between 2022 and 2024. Of those planning to leave within 5 years, approximately 41.5% cited stress and burnout as the root cause. And the median age of the nursing workforce is now 50 years old. A National Council of State Boards of Nursing 50, which means a very large number of experienced nurses are in or approaching the window where retiring abroad is not a fantasy, it is a logistical question. And the logical question is, why abroad? 3 reasons, and they are not complicated. First, cost. The cost of living in most comparable English-speaking or expat-friendly destinations is dramatically lower than the United States or the United Kingdom, meaningfully lower, not 10% lower, sometimes 60 or 70% lower. Second, healthcare. The bitter irony of being a healthcare worker is that you often have some of the worst access to affordable personal healthcare because you understand exactly how broken the system is. In many of the countries we are about to discuss, the healthcare is not only cheaper,
It is better in the ways that matter most for day-to-day life. Third, peace. I keep coming back to this word because it is what nurses tell me they want most. Not luxury, not adventure necessarily, not excitement, peace, a slower pace, somewhere that does not feel like it is constantly demanding something from them, somewhere they can walk to a market, sit by water, have a coffee that lasts longer than 3 minutes. Eat a meal without standing. These are genuinely low bars. And yet for many nurses, they represent something they have not reliably experienced in years. Let us find where to get them. Portugal keeps appearing at the top of every reputable retirement index, and honestly, it has earned that position. Portugal's monthly cost of living sits at approximately €776 per person, excluding rent. Smaller inland towns can offer a comfortable lifestyle for $1,500 to $2,000 per month, while Lisbon and the Algarve coast typically run $2,500 to $3,500. For a retired nurse on a reasonable pension, $4,500 to $2,000 per month for a full life is a transformative number. That is a number where you do not have to choose between medication and groceries, a number where rent does not consume your entire income, a number where retirement actually feels like retirement. The healthcare situation in Portugal deserves specific attention from this audience. You spent 30 years working in a healthcare system. You know what good care looks like. You can spot the difference between a well-run ward and a disaster area before you have finished signing in. So, when I tell you Portugal's healthcare is good, I want to give you the detail rather than the brochure language. Portugal's public healthcare system provides comprehensive care to legal residents, including hospital treatment, GP visits, and prescriptions. Co-payments for consultations average between $5 and $20. Private insurance for those who want faster specialist access costs around $50 to $100 per month. So, as someone who has worked in healthcare, you will find Portugal's private sector refreshingly functional. Doctors who have time, appointments that are booked and kept, a consultation that lasts longer than 8 minutes because the system is not strangling the life out of every clinician working in it. There is a certain quiet irony in moving abroad and discovering that your new doctor has time to actually sit down with you. The D7 passive income visa is the primary route for retirees. Applicants need to demonstrate approximately $870 per month in passive income, about $900 USD, along with evidence of stable finances and housing. That is a genuinely accessible threshold for anyone with a nursing pension. What Portugal gets right for this particular audience safety, it consistently ranks in the top 10 of the Global Peace Index. A slow, food-oriented culture that genuinely values rest, walkable towns and cities, and weather that makes going outside for a walk feel like a choice you actively want to make rather than an obligation. The one thing nurses consistently mention after arriving in Portugal, the silence, not the absence of sound, the absence of urgency. Nobody needs anything from you. Not immediately, not constantly. For people who have lived their professional lives in a state of constant readiness, that silence can take some getting used to. Give it a few weeks. Costa Rica keeps coming up in these conversations for a reason, and it is a reason that speaks directly to the nurse who has spent 30 years being told to do more with less. Single people in Costa Rica live on about $1,500 a month, while couples spend over $4,000 depending on lifestyle. The philosophy of pura vida, pure life, is a genuine cultural orientation toward well-being, time outdoors, and not making everything complicated. You pause for a moment and consider what a profound relief that sentence represents after a career in healthcare administration, electronic health records that were designed by people who have never worked a shift, and a staffing model that treats human beings as interchangeable units. Costa Rica's healthcare system for expats works through a structure called the CAJA, the Public Universal Health System. Pensionado visa holders are required to join the Kaja. Private appointments are easy to schedule and far more affordable than in the US. A mammogram and a dermatologist appointment together cost around $50 through private discount programs. Dental care is accessible. A recent patient reported a cleaning and checkup for $70. A mammogram for about $25. Out of pocket. Nurses, you know what that costs at home. You know what the insurance argument looks like, the prior authorization, the appeal, the second appeal, the letter from the specialist, the denial, the second denial, the third attempt. In Costa Rica, you just book it, pay $25, done. The Pensionado visa requires a minimum of $1,000 per month in pension income, and residency typically takes 6 to 18 months to process. One important honest note about Costa Rica that the glossy travel content omits. The quality of infrastructure varies significantly by region. Coastal areas near popular expat hubs, Tamarindo, Manuel Antonio, the Central Valley near San Jose, are well served and comfortable. Truly rural areas require more self-sufficiency and a higher tolerance for infrastructure that is not always consistent. But here is what nurses report about Costa Rica that never makes it into the stats: the people. Warm in a way that is not performative, genuinely community-oriented. Neighbors who notice when you are new and bring things over. The kind of social environment that most nurses spent their career providing for patients but rarely experienced in their own lives. Costa Rica is best for nurses who want nature every single day, who want to wake up hearing birds rather than traffic, who have spent 30 years in fluorescent light and want to spend the next 30 in actual sunlight, who are done with complicated and want simple, warm and real. Malaysia is the country that most people in this audience have not considered yet. And it is the one that tends to produce the strongest reactions when people actually look at the numbers. In Kuala Lumpur or Penang, a couple can live well on $1,500 to $2,000 per month and enjoy modern healthcare at a fraction of US costs. A couple, $1,500 to $2,000 per month, together including healthcare. Malaysia's healthcare system has something that will be immediately recognizable to any nurse who has ever worked in a well-run environment. It is organized. Malaysia's healthcare system is a standout in Southeast Asia, known for its modern facilities and English-speaking medical staff. Many hospitals are JCI accredited. The country is a favored destination for health-conscious expats, specifically because of the quality and low cost of private healthcare. JCI accredited hospitals, English-speaking staff, modern facilities, and the cost. Specialist consultations in Malaysia typically run between $30 and $50 out of pocket, without insurance. As a walk-in, as a nurse, you will immediately grasp what this means in human terms. People can actually access the care they need without the financial anxiety that makes healthcare a crisis before it becomes a clinical one. Penang specifically deserves mention. Penang's charm is in its people. The expat community is not closed off, it is part of the bigger picture. Locals and foreigners volunteer together, play sports, join book clubs, and connect over shared meals. English is widely spoken. The social infrastructure matters enormously for nurses in retirement. You spent your career surrounded by people, working in teams, always part of something. The transition to complete solitude is, for many nurses, not peaceful. It is disorienting. Penang has a community that catches you. The food also deserves its own paragraph. Penang is widely considered one of the food capitals of Asia. For nurses who are used to eating whatever is available in 8 minutes during a shift, eating extraordinary food slowly at a table for about $4. This alone reportedly produces a kind of joy that takes people by surprise. The honest caveat: Malaysia requires some tolerance for humidity. If you thrive in warmth but struggle with persistently hot and sticky weather year-round, consider whether that is your climate. Penang is significantly cooler and more manageable than the deep south of the peninsula. Malaysia is best for nurses who want the maximum purchasing power for their pension, who want modern healthcare at a fraction of Western costs, who enjoy Asian food culture and warm social environments, and who want a genuinely international English-speaking community. Thailand has been on retirement lists for years, and there is a reason it refuses to leave. A GP consultation in Thailand typically costs between $30 and $50. Private health insurance plans start at approximately $100 per month, offering comprehensive coverage including specialist care. International hospitals are equipped with cutting-edge technology, and English-speaking doctors are widely available. For retired nurses specifically, Thailand's private hospital sector is almost unsettling in how good it is. Bumrungrad International Hospital in Bangkok, where many expats go for care, is internationally accredited, staffed by specialists who trained in the United States, the UK and Australia, and operates with a standard of clinical organisation and patient experience that you will recognise immediately as genuine quality. You spent your career being able to tell the difference. You can walk into a healthcare environment and know within 10 minutes whether it is the real thing or the appearance of the real thing. Thailand's top private hospitals are the real thing. The retirement visa for Thailand, the OA visa, is available to those over 50 and requires demonstrating either 800,000 Thai baht in a Thai bank account, approximately 23,000, or a monthly income of 65,000 baht, approximately 1,900. It is renewable annually. What Thailand gets uniquely right for this audience: the pace. Thailand is one of those places where retirees often say, "I can finally breathe." The Buddhist cultural influence creates a society that respects elders. The concept of sanuk, roughly translated as joy, permeates daily life. Food is incredible, fresh, and costs less than cooking at home. A society that respects elders. Take that in for a moment. After years in a healthcare system that treats nurses as labor to be scheduled and rescheduled, as units of output rather than experienced professionals, as people whose knowledge and expertise are extracted and underpaid, a culture that genuinely respects age and experience is not a small thing. It is actually quite a large thing. This section is specifically for people who have spent decades in healthcare, because there is a specific retirement transition that nurses, paramedics, doctors, and healthcare workers face that the general retirement abroad content does not address. You are going to try to fix things. You are going to find yourself in a foreign clinic and mentally rearranging the ward layout for efficiency. You are going to see a patient being moved incorrectly and physically fight the urge to intervene. You are going to have a conversation with a local doctor and realize you know more about a specific drug interaction than they are letting on, and it will be very, very difficult not to mention it. You are also, and this is the important one, going to struggle at first with not being needed. For nurses especially, being needed is not just professional, it is identity level. The call light is not just a light. It is confirmation that you matter, that your skills matter, that you are in the right place. When the call light goes away, something has to fill that space. The good news: abroad, there are communities that will absolutely find a use for a retired nurse. Expat communities in almost every destination we have discussed have informal health advice networks, volunteer clinics, English language health information services for locals. You will not be idle. You will not be irrelevant. You will just, for the first time, be choosing when to give. That transition up from obligation to choice is the real retirement. And it turns out most nurses find it is not as scary as they expected. They find it is in fact quite wonderful. Here is the plain language breakdown. If you want Europe, history, safety, walkable cities, and you have a pension above roughly $1,800 per month, Portugal, the D7 visa, the Algarve or the Silver Coast rather than Lisbon if you want quiet. Healthcare is solid, costs are reasonable, and the people are genuinely warm. If you want nature, warm community, good private healthcare, and a cultural philosophy that actively discourages urgency, Costa Rica. The Pensionado visa requires $1,000 per month in pension income. Budget $1,500 to $2,500 per month, depending on location and lifestyle. If you want the best purchasing power, English-speaking, modern infrastructure, excellent private hospitals, and extraordinary food, Malaysia, specifically Penang. Budget $1,500 to $2,000 per month as a couple. The MM2H program for long-term residency is worth researching with an immigration specialist. If you want warm climate, world-class private healthcare at a fraction of Western costs, a respectful culture, and the option of beach or city, Thailand. Budget $1,500 to $2,500 per month. The OA retirement visa requires financial proof and is renewable. And for nurses specifically who want all of these things but are still holding back, the thing you are waiting for, the moment when it feels like you have officially been given permission to stop carrying everyone else, is not coming. Nobody is going to hand it to you. You are going to have to decide that you have already earned it, because you have. I want to end with something that is not about visa requirements or monthly budgets. In 2025, nurses were ranked the most trusted profession in the United States for the 22nd consecutive year. AM Healthcare, 22 consecutive years. The most trusted, the most relied upon, the people that other people, when they are frightened and vulnerable and at their worst, reach for. That trust was not given freely. It was built over shifts that ran long, over patients who are difficult, over 1,000 small moments of choosing to stay present when everything in you wanted to step away. You earned that trust. You also earned the right to stop being everyone's first call. The world will find a way to keep turning without you on that ward. The patients will get their medication. The charts will get filed. The call light will get answered. And somewhere, in a Portuguese fishing village or a Costa Rican mountain town or a Malaysian city where your pension makes you genuinely comfortable, there is a morning waiting for you. No pager, no overhead announcement, just quiet. You earned it. Go get it. If this video spoke to you, if you are a nurse, a paramedic, a healthcare assistant, a ward clerk, or anyone who has spent their career in the service of other people's health, subscribe. This channel is going to keep making content for the people those glossy retirement videos forget. Hit subscribe. Drop a comment. Tell me how long you worked, what you did, and where you are thinking about going, because I want to hear from you, not your patient, not your employer, you. See you in the next one.